topic that is remaining after that. Now, in case of this anticoagulants, you have some idea what is an anticoagulant? Because substance that is preventing coagulation. So any drug that helps to prevent the formation of blood clot. We have been studying about what are blood clotting, what is blood clotting, and how this blood clotting is taking place. So there are few drugs, there are also few substances that prevent the formation of blood clotting, and they are known by the name anticoagulant. Sometimes they are also known by the name blood thinners. So there is another term for anticoagulant. Now the mechanism of their work is mainly by interrupting. Interrupting means blocking the clotting process. So we have studied that in the case of clotting, the main event is the fibrinogen will be converted into fibrin threads. That is a primary reaction or primary process which occur during the blood clotting, and these drugs will be preventing this formation of fibrin threads. That is the main mechanism of action. So blood clotting process involves a series of steps that culminate. Culminate means to end. That is a final stage, culmination, the end stage in the formation of a fibrin clot. So anticoagulants will be targeting the various steps in this clotting process, and they will be either preventing the blood clotting or they will be slowing down the clotting process. So this is the main mechanism of blood clotting. Now here you can see that there are number of substances which are working as anticoagulant. One is known as a vitamin K antagonistic. So here you can see the mechanism is very clearly explained here. It will be inhibiting the enzyme vitamin K epoxide reductase. There is an enzyme known as vitamin K epoxide reductase, reducing the synthesis of active clotting factors. So we have seen that there are 12 or 13 clotting factors are there. They are all proteins. These are clotting factor 2, 7, 9 and 10. So this vitamin K antagonistic, an example is warfarin, it's a drug. That drug will be interfering with the working of vitamin K epoxide reductase. It's an enzyme. So that these 4 factors, clotting factors, may not be formed. So their primary use is that they will be using in the form of atrial fibrillation. Atrial fibrillation means auricle will be working in a over. I'll tell you what is. I will show you a picture of how this atrial fibrillation will be. So basically, atrial fibrillation, irregular and very rapid heart rhythm that can lead to stroke, heart failure, and complication. Here you can see that this auricle, this upper chambers or atrium, will be showing an irregular contraction, and that is known by the name atrial fibrillation. So that is what is happening in the case of this atrial fibrillation. So mainly it will be preventing clotting in people with this atrial fibrillation. Mechanical heart valves. Sometimes the valve of the heart may not be working. You have studied about bicuspid valve, tricuspid valve, and semi-lunar valve. From high school classes onwards, you will be studying about these 2 valves. So sometimes these valves may not be working properly. And in such people, we will be introducing a steel valve, sometimes made up of titanium. So such type of valves are known as the artificial valves or mechanical heart valves. When we are putting this artificial heart valve, that will be creating atrial fibrillation. So to prevent that will be leading to a clot formation within the heart. So in such people, we will be using this sort of drugs. Another drug is direct thrombin inhibitors. So where thrombin is needed, thrombin will be converted into thrombin. Thrombin is the enzyme. For example, in the case of clot formation, we have studied that fibrin will be converted into fibrinogen. And for that an enzyme is needed that is known as a thrombin. So thrombin is the enzyme that will be converting fibrinogen into fibrin. So what these direct thrombin inhibitors are doing, they will be directly inhibiting the thrombin and or factor 2A, preventing the conversion of fibrinogen. This is the main event in a clotting process. For fibrinogen to convert into fibrin, thrombin is needed. So this type of inhibitors, direct thrombin inhibitors, dadiglutatran. Such types of drugs will be preventing the formation of thrombin from prothrombin. So that is the way it will be working, and their use is that they will be preventing stroke, blood clot in patients with non-valvular atrial fibrillation and deep vein thrombosis and PE. These are the different type of uses this direct thrombin inhibitors can have. Then another is direct factor XA. XA is another type of clotting factor. An active form of clotting factor X will be prevented. So here we have two types of drug, rivaroxaban, apixaban. So these are the two types of what they are doing is that they will not allow the formation of active form of clotting factor 10. So that preventing the and that clotting factor 10 is mainly important in the conversion of prothrombin to thrombin, thereby reducing the fibrin formation. So only if thrombin is there, fibrinogen will be converted into fibrin. So here the clotting factor 10 or will be 10 formation of active form of clotting factor 10 or 10A will be prevented. And their uses are, it will be using in the treatment of deep vein thrombosis PE and reduce the risk of stroke in people with the auricular or atrial problem. So this is another type of action that we are seeing in the use of direct factor inhibitors. Then one more type of action is also the heparin and low molecular weight heparin. These are the another type of anticoagulant. They will be enhancing the activity of antithrombin 3, inhibiting the thrombin and factor 10A formation. So this factor 10 as well as thrombin are needed for the formation of fibrin from fibrinogen. Fibrinogen to fibrin means there is an enzyme is involved. Here you can see that this process fibrinogen to fibrin, we need an enzyme known by the name thrombin. And for thrombin to prothrombin, another substance known as 10A, active form of 10A is needed. So in the second case, direct factor 10A inhibitors, they will be preventing the formation of thrombin. Then another is heparin. Heparin, what they are doing, they will be enhancing the activity of antithrombin 3. It's a substance that interferes with the thrombin, inhibiting thrombin and factor 10A. So these are the two important factors which are helping in the formation of fibrin. Antithrombin 3 will be preventing or inhibiting the action of thrombin and factor 10A. So that formation of clot will not be taking place. So heparin is a very common anticoagulant used in our hospital, and they are also used for long-term treatment also. So this is an idea regarding how are the different type of anticoagulant and how they are working. Mainly we have direct factor 10A inhibitors, heparin are the, then direct thrombin inhibitors are the, and vitamin K antagonists are the. These are the four different type of anticoagulant and how they are working. So that is the an idea regarding how the different types of anticoagulants are working.